The Ministry of Health, together with Uganda Women's Cancer Support Organization, are calling upon parents and guardians to take their children aged 10 and above for human papillomavirus vaccination against cervical cancer. The appeal was made during stakeholders' engagement meeting to assess the uptake of human papillomavirus in the country. The prevalence of cervical cancer is on the rise among low-income countries and causes significant morbidity and mortality. Human papillomavirus screening and vaccination is projected to prevent up to 1 death per 1,000 women by 2034.
Women who are between 25 to 49 years should be able to be screened for cancer of the cervix every after 3 years. And those who are living with the HIV/AIDS should be able to be screened every year. But we have noted with concern that many of our women are not actually taking up this kind of service. And eventually what happens is that those who get a cancer of the cervix, by the time they get to know, it is too late. That's why we tend to lose many of these women.
If we can emphasize full vaccination against the human papillomavirus, we have the capacity to completely eliminate cervical cancer in Uganda. So we are making a call, an appeal to all of us, parents out there, please take your children, 10 years, at the age of 10, the young girls, ensure that they go for cervical cancer vaccination of the human papillomavirus, and it is a routine immunization available as and when you need it at the health center, and it is free. That is our appeal, because with that we shall improve the health of mothers and girls in this country. Thank you.
Now activists are calling upon the government and the Ministry of Health to invest heavily in cancer data collection in the country for proper management.
Is improved data collection. A lot of the data that we use is from just the Kampala Cancer Registry. So this is one thing that as a country we need to invest in, because we cannot effectively address these issues if we don't even know the numbers of women that are affected. So whatever we talk about in terms of burden are mostly what has been got from within Kampala, but we know that one of the biggest challenges we have with cancer care in this country is that over 70% of those who are diagnosed with cancer, breast cancer, cervical cancer, report when it is already late.
More than 80% of sexually active men and women worldwide are prone to contracting human papillomavirus. HPV is responsible for an estimated 630,000 new cases of cervical and genitourinary cancer worldwide annually. Zahara Abigaba, UBC News.